What's happening with the London AKI manual update?
So as part of our new products that we're launching this year, we've updated the AKI manual. The AKI manual has been quite a popular resource where it's really an attempt to operationalise national guidance and consensus, which is often very high quality but difficult to access into concise clinical pathways that junior doctors, nurses and other non-specialists can access really quickly. And we have not only the the core AKI pathway criteria for referral, criteria for transfer, but also some specific areas like contrast prophylaxis, fluid therapy, perioperative AKI. And with our 2015 update of this, we're bringing this up to date with the NICE clinical guideline, the NICE quality standard, some advisories that have come down from the Think Kidneys national programme, and some other tweaks to make this hopefully improve this. And also we're introducing some new pathways, specifically AKI in HUS and also AKI in pregnancy, which are pieces of work that have been developed with stakeholders in those clinical areas. And the contents of the core manual will obviously go into our app, our website resource of guidance, and into some of our teaching materials as well.
What is the London AKI standard?
So the London AKI standard is a new resource that we've produced where we are trying to map and collate what can be a sort of slightly confusing for Trust AKI leads a range of national standards and advisories. So they come from NICE and they come from elsewhere in CPOD, for example, and also some local standards that we've agreed across the network. So basically this is a bullet point summary of things at organisational and at patient level should be delivered to manage AKI patients effectively. So that's something we're releasing in 2015 following some stakeholder engagement, and that's a new product.
Can you explain what the London AKI organisational audit is?
So this is a survey that we originally undertook in 2012. So this is basically the organisational standard self-assessment, and we're doing this again in late 2015, and this is really a way of us understanding how far on trusts are with implementing core organisational standards for what should be delivered. And that's do they have live guidance, do they have the laking guidance, have they implemented the national AKI e-alert, and do they have appropriate levels of renal support in the organisation, can they provide acute renal replacement therapy 24/7, etc. So these are one or two local standards that we've put together, but also collating quality standards from NICE and CPOD and putting that out as an organisational survey. So we have done this before, and we're doing this again, so we're asking the medical directors and Trust AKI leads to return on this, and we'll be releasing anonymised, non-benchmark data again in 2016.
Can you give me some details about My AKI?
So we've had for some time some patient experience, some patient information resource on London AKI Net, and we're now putting this out as a PDF patient information sheet that trusts can either adapt or use directly, just to when patients have had a significant change in kidney function during an admission and have been told that they have AKI, that they've got a patient information leaflet to take home. So that's something that we're releasing to all the London Trust AKI leads.
Will there be a new London AKI mobile app?
Yes, so we are updating the app in, so Vince will tell me exactly when this is coming out, but so we are releasing the app. We get a lot of queries about this, so the app is being updated. It's going to have video content, and it will be coming out on iOS 9, iPad and Android in early 2016, just as soon as we get it through the Apple Store and the various other people we're reliant on to make this happen. So yes is the answer to that.
Can you give me some information about LondonAKI.net?
So LondonAKI.net is an online resource mainly aimed at healthcare professionals, but we also at patients, and we use this to flag forthcoming events, AKI news more generally, but it also hosts all our content in terms of educational materials, pathways, clinical standards, audit results, and so on and so forth. We've also advised Trust AKI leads where possible to link their AKI alerts to this resource, such that junior docs and other people can access this. And we've had a number of iterative updates to this this website over the last couple of years, and another big revamp in 2015. So that's really all the network's done, and all the network resources on a website.
Are there any new educational products coming along soon?
So we have been working on some further educational products. So we run the AKI Academy, which we filmed, and we're releasing to free access online a large amount of those lectures. We've also done some what could be described as pickups of other talks and lectures that we're going online. We have a nurse education resource which is being released for the first time, and we're also releasing an iBook, so that's a sort of interactive PDF with embedded video content, which we've not done previously. So that's again going to be free text, pathways, and video content around specific aspects of AKI care, and most of this is going to land within towards the end of 2015 or early 2016.
Are you going to be releasing any of the data you've accumulated?
So we are releasing some audit data. We don't benchmark our organisations. Some of the data that we're doing on large-scale data collection on Trust AKI will probably be published, and in addition we have various audit data sets that we've either released or in the process of releasing online or as reports to the Strategic Clinical Network. But we generally avoid benchmarking organisations, but our ethos is to certainly let the organisations know how that they are doing, and the fact that we are here to help them with improvements through our resources and events and other support that we can provide.
What's in the tin?
So the tin is something that we've put together with Vince and colleagues' help for the November 17th event, and there's one or two surprises that I'm not going to release, but we are collating all our resources into a USB stick, so people can have offline access to all this. So that's most of our video content, all our various other educational products, guidance, updates, audit reports, etc. And that's being given to the delegates for our November 17th event, but in addition is going to be sent to all the chief executives, medical directors and Trust AKI leads for the London hospitals, so they've got that too. We're actually putting the resources directly, physically into their hands, such that they can use them as they see fit.